Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So, let's take a look.
Hello everyone, welcome to this video where I'm going to tell you all about Galaver. Galaver is a combination of magaldrate and dimethicone used to relieve various digestive problems. This medicine works well for reflux esophagitis, gastroesophageal reflux disease, hiatal hernia, and also for gastritis, both acute and chronic. If you've ever had that burning sensation in your stomach or chest, Galaver could be the solution. How does Galaver work? Well, it neutralizes the acid in your stomach and also reduces gas. Magaldrate works as an antacid, while dimethicone helps you eliminate those annoying gas bubbles. The result is quick and effective relief. Regarding the dosage, it's always best to follow your doctor's instruction. Normally, you usually start with 1 or 2 teaspoons, 3 or 4 times a day. Then, to keep feeling well, the dose can be adjusted according to how you feel. As with all medications, Galaver can have some side effects. The most common are diarrhea or constipation. If you notice any negative reaction, it's important to tell your doctor right away. Remember that you should not take Galaver if you have serious kidney problems or if you are allergic to any of its ingredients. In short, Galaver is a great option to treat common digestive problems. Always follow your doctor's instructions and don't be afraid to ask if anything is unclear. Thanks for watching this video and take care.
If you've made it this far, let us know in the comments why you're using this medicine.